If you were just diagnosed with osteoporosis, listen carefully, because the next 12 months can decide something most people never see coming. Not your scan, your independence. It starts when you hesitate on the stairs or in the shower because you don't trust your body. Most people do the responsible things, calcium, vitamin D, more walking, while their real fracture risk is still climbing. In this video, I'll show you what that 12-month window really is and the one follow-up step that prevents a second fracture from stealing your freedom. And one more thing, some treatments move fast, but they come with rules and warnings you must take seriously. So let's talk about the one-year bone-building option called romosozumab, better known as Evenity, and who it's actually for. Because in the US, a fracture isn't just pain, it's imaging bills, rehab appointments, missed work, caregiver stress, and that quiet fear that settles in after the first crack. The fear that the next one could take your independence and that you'll start living smaller, not because you want to, but because you don't trust your body anymore. So today, we're talking about a medication that doesn't just slow bone loss, it's designed to rebuild bone fast. And understanding when that speed helps and when it's the wrong move is the difference between having a plan and just having a prescription. But I'm not here to sell you on it. I'm here to put it in the right mental box, because romosozumab is not just a stronger osteoporosis drug, it's a different strategy. It's meant for a specific kind of risk for a specific window of time with specific trade-offs. And if you don't understand the strategy, you can do everything right and still get blindsided. Let me show you how that happens with a quick story. A guy named Mike, early 60s, still working, still active, not a gym rat, but not sedentary either. He gets told his bone density is low. He hears the word osteoporosis and immediately thinks, okay, calcium, vitamin D, and I'll walk more. He does exactly that. He feels proud. He feels in control. And then, months later, he slips on a wet patch in the driveway. Nothing dramatic, just a normal fall. Except this time, his wrist breaks. And what hits him hardest isn't the cast, it's the thought, wait, was I living on borrowed time? That's the emotional gut punch of osteoporosis. You don't feel it until the day you do. Now here's the part most people don't get told in plain English. Osteoporosis care isn't one decision, it's a sequence of decisions, and the sequence matters. Most osteoporosis medications people hear about first, like common bisphosphonates or denosumab, are basically demolition control. They slow down the cells that break bone down. That matters, and for many people, it's exactly the right move. But if someone is already in the danger zone with very low bone density, spine fractures, multiple fragility fractures, or fractures even while on therapy, slowing demolition may not be enough to keep the building standing. So here's the question I want you to sit with, and don't answer it quickly. If you knew your fracture risk was climbing fast, would you rather slow the damage or rebuild strength first? That's the logic behind bone-building therapy, also called anabolic therapy. Romosozumab lives in that category, and it works through a target most people have never heard of, a protein called sclerotin. Think of sclerotin like a brake pedal on bone formation. Your body uses it to keep bone building from going too far. Romosozumab blocks that brake, so bone formation can ramp up. And what makes it especially interesting is that it doesn't only push the gas on building, it also eases off bone breakdown, at least for a period. Two jobs at once: build new bone faster and reduce the pace of bone resorption. That sounds like a dream, so why isn't everyone on it? Because medicine is never just about what works, it's about what fits. Your fracture risk, your medical history, your priorities, your tolerance for uncertainty, and yes, your cardiovascular profile. Here's an open loop I want to keep hanging in the air while we go deeper. The most important question isn't, will it build bone? The most important question is, what does it cost, in risk, to build it that fast? Now let's get concrete, because romosozumab isn't a maybe someday medication. It's a right patient, right moment medication. In the US practice, it's usually considered when someone is at very high fracture risk. That phrase sounds vague,
But it's not meant to be. Very high risk often looks like you've already had a fragility fracture, especially a spine or hip fracture, or you've had multiple fractures.
Or you fractured while already on therapy, or your bone density is deeply in the osteoporosis range plus other red flags, or you're in that scary category of being one fall away from a life-changing injury. And here's the stance I want to be crystal clear about. If you're very high risk, the goal isn't to win a lab report. The goal is to prevent the next fracture in the next 6 to 18 months, because that's when risk can spike. Fractures can cluster. After one fracture, the risk of another can rise sharply, especially in the first year or two. So speed can matter, not for vanity, but for independence. That's romosozumab's pitch, speed. Now, what does treatment actually look like in real life? Romosozumab is typically given as monthly injections for 12 months, not 3 years, not until further notice, 1 year. And if you're picturing something complicated, here's what it often looks like. You come in once a month, the medication is given as 2 injections, and you're done. It becomes part of your calendar, like a standing appointment. For some people, that routine actually helps because it creates momentum. You're not thinking about osteoporosis every day, but you're consistently doing the one thing that moves the plan forward. But here's the part that separates people who do well from people who end up disappointed. Romosozumab is usually step 1, not the whole plan. After that 12-month window, most patients transition to an anti-resorptive medication, something that helps lock in the gains by slowing breakdown. If you build a stronger wall, you still need to protect it from erosion. So the real question isn't just, should I take Evenity? The real question is, what sequence gives me the best odds over the next few years? And now we have to talk about the elephant in the room, safety. Romosozumab carries a boxed warning about potential increased risk of heart attack, stroke, and cardiovascular death in certain contexts. That means it's not a casual decision, especially if you've had a heart attack or stroke recently, or you have significant cardiovascular risk. Let me say this in plain English. Bone strength is not worth gambling with your heart. So the risk conversation should sound like an adult conversation. Not, do I feel fine, but what is my actual risk profile? Blood pressure, cholesterol, diabetes, smoking history, family history, prior events. And if you've had a recent heart attack or stroke, that changes the discussion. And while we're here, I want to say something people don't love hearing, but it's important. If you're in a rushed appointment, it is your job to slow the conversation down. Because if you don't, you might walk out with a prescription, but no strategy. Here's your second reflective question, and I want you to feel how uncomfortable it is. Are you choosing treatment based on what feels safest emotionally, or what actually reduces the most risk in your specific situation? Because sometimes the scariest drug on paper is the one that prevents the scariest outcome, if you're the right candidate. And sometimes the strongest drug is the wrong fit because your biggest risk isn't your bones, it's your cardiovascular profile. Now, one quick myth to break because it affects a lot of Americans over 40. Supplements are not a treatment for severe osteoporosis. Calcium and vitamin D can support the system, sure, but they do not rebuild a fragile skeleton by themselves. If your house is on fire, a bucket is not the same as a fire department. Supplements may be part of the plan, but they are not the plan. Another practical truth, especially in the US, paperwork can decide your timeline. Some insurance plans require prior authorization. Some want proof you're high risk. Some require documentation of fractures or prior therapy. That's not medical advice, that's just the reality of the system. So part of being smart here is making sure your doctor's office has the records, the DEXA results, and the fracture history clearly documented. Because when you're high risk, delays aren't just annoying, delays can be dangerous. So, what did studies and clinical outcomes show in broad terms?
Romosozumab can increase bone mineral density and reduce certain fracture risks, especially vertebral fractures, when used in that 1-year window and then followed by another therapy. And that phrase matters so much, I'll say it again. Build, then maintain. Now, here comes the uncomfortable truth. A lot of people fail osteoporosis treatment not because the medication didn't work, but because the plan wasn't built like a plan. It was built like a single prescription. So let's go deeper than benefits and risks. Let's talk about the part of osteoporosis care that feels almost unfair.
You can do everything right. Take an expensive medication, watch your bone density number improve, and still end up in trouble because of what happens when the medication stops. This is where people get blindsided. Osteoporosis isn't one problem, it's two problems. The first problem is how fast you can build or preserve bone today. The second problem is how well you can hold on to it tomorrow. Romosozumab is the build fast move, but if you don't follow it with the hold move, it's like renovating your house and leaving the windows open in a hurricane. You did the hard part, you paid for the hard part, and then you lose ground because the after was vague. Zoom out and think of osteoporosis strategies in 3 buckets. One bucket is slowing breakdown, which is where many anti-resorptives live. Another bucket is building new bone, which is where anabolics live. And the third is the sequence, how you stack them so the next step protects the last step. Here's why sequencing isn't doctor trivia. Sequencing is outcomes. Some drugs are forgiving when you stop them, some are not. There are treatments where stopping abruptly can lead to bone turnover rebounding, meaning your body starts breaking down bone faster again. That doesn't automatically mean the medication was bad. It means it was powerful and your plan needs an exit ramp. So when I say romosozumab is 1 year, I'm not saying, cool, you're done. I'm saying you're at halftime. The best version of this story is 1 year building, then maintenance therapy, then long-term monitoring. And monitoring matters more than people think because osteoporosis is sneaky. It doesn't hurt until it breaks something. So you measure what you can. You track bone density over time, usually with a DEXA scan. You track fracture history. You track height loss. And you pay attention to something most people ignore until it's too late, your confidence in movement. Because bone strength is only half the equation. The other half is will you land wrong? Let me paint this so it sticks. 2 people have the same bone density score, same age, same medication. One lifts weights twice a week, practices balance, sleeps like it's their job, eats enough protein, and keeps their vision prescription updated. The other person is exhausted, under-muscled, on 3 medications that make them dizzy, and they rush downstairs in socks because they're late. Same bones on paper, completely different futures. This is where my opinion gets blunt. If you're over 40 and you're treating osteoporosis without treating muscle and balance, you're paying for a roof while ignoring the foundation. Strength training doesn't just help bones, it builds the shock absorbers that keep fractures from happening. Stronger hips, better reflexes, better balance, more stable steps. And no, you don't need to become a gym person. You need to become a hard-to-knock-over person. That can look very unglamorous. Chair stands, step-ups, carrying something moderately heavy with good posture, safe hinge movements with guidance, gentle resistance work that progresses over time, balance practice near a kitchen counter, walking with intention, not just wandering, getting enough protein earlier in the day, not only at dinner, treating sleep apnea if it's there, reviewing medications that increase dizziness or fall risk with your clinician, getting your vision and hearing checked because balance is not just legs, it's brain plus senses. And here's another question most people skip, but it matters. Are you eating enough protein to support muscle while you're trying to protect bone? Because for many adults 40 plus, the issue isn't only calcium, it's under-muscling. And under-muscling is basically a fall risk multiplier. This doesn't mean a trendy diet, it means enough building material so your body can actually respond to training, physical therapy, and daily life. And let's talk about money for a second, because this is America and we all feel it.
Romosozumab can be expensive depending on insurance. Imaging can be expensive. Physical therapy can be expensive. But here's the real cost that nobody wants to price out. A hip fracture can turn into a whole different life. It can turn into months of rehab, loss of confidence, and sometimes a permanent step down in independence. So if you're considering an anabolic medication, the question isn't only, is it covered? The question is, am I building a plan that makes that cost worth it? Here's your third reflective question, and I want you to be honest with yourself, not optimistic. If you got 1 year to rebuild your bones, would your daily habits protect that rebuild or quietly sabotage it? Because this is the trap.
People obsess over the injection and ignore the environment that injection is landing in. Now I'm going to say the quiet part out loud. Sometimes the best osteoporosis plan is not the strongest medication. Sometimes it's the most coherent plan. Medication plus strength plus fall-proofing plus follow-up. And that sets us up for the most practical part of this whole conversation. What do you ask your doctor specifically so you don't walk out with a prescription but no strategy? Imagine the appointment. You're sitting on that paper-covered exam table. The conversation is rushed. Someone says, your DEXA shows osteoporosis, and before you can even process the word, you're being offered a medication like it's a single yes or no question. If you're genuinely high risk, the smartest move is to turn that visit into a strategy session. So here's the checklist I want you to keep in your pocket. First, ask, am I high risk or very high risk? Not as a label, as a decision point. Second, ask, what's the plan after month 12? If the answer is vague, like, we'll see how you do, that's a red flag. 1 year of building without a maintenance plan is like filling a bucket with a hole in it. Third, ask, what is my cardiovascular risk profile, honestly? Not do I feel fine, but the real profile. And ask directly if any recent heart attack or stroke changes the risk-benefit calculation. Fourth, ask, what are we checking before we start? Calcium and vitamin D status can matter. Other labs may matter depending on your case. If you're starting a powerful therapy, you should know what baseline looks like. Fifth, ask, what counts as an emergency symptom? And I'm going to be calm but firm here. If you ever experience signs of a heart attack or stroke, like chest pressure, shortness of breath, sudden weakness on one side, facial droop, trouble speaking, or a sudden severe headache, treat it as an emergency and seek immediate medical care. Don't wait and see. And now, the part people avoid because it feels personal. Falls. Ask, can we make a fall risk plan like it's part of treatment? That might include physical therapy for balance and gait, strength training guidance, a review of medications that cause dizziness, and practical home changes, better lighting, securing rugs, railings that actually feel solid, bathroom safety upgrades that aren't embarrassing, they're intelligent, shoes you can trust. Because the fracture doesn't happen in your bones first, it happens in the moment you lose stability. And now we can close that open loop from earlier. What does it cost in risk to build bone that fast? The real answer is this. Romosozumab can be a powerful tool for the right person at the right moment, but you pay for power with responsibility. Responsibility to screen cardiovascular risk, responsibility to follow with maintenance therapy, responsibility to build muscle and reduce fall risk while the medication is doing its job. Now, here's your fourth reflective question, and I want you to picture your real life when you answer it. When you picture your future 5 years from now, what matters more? Seeing a better number on a scan, or knowing you can move through your day without fear? Because that's the finish line. Not perfect bones, a life that still feels like yours. And before we end, an explicit disclaimer because this matters. I am not a doctor, and this is not medical advice. Osteoporosis treatment is highly individual. Talk with your physician or a qualified clinician about your fracture risk, cardiovascular history, lab work, and the safest medication sequence for you. Now, I want to leave you with a next step that's not hype, not motivation, just reality.
Tonight, write down 2 things. First, the question you're afraid to ask your doctor, the question you keep swallowing because you don't want to sound difficult. Write it down anyway. Second, choose one habit you will actually do for the next 14 days, something small but real, like 10 minutes of strength and balance work 3 times a week, safely, consistently. Because the strongest plan isn't the one that sounds impressive, it's the one you can execute. And if you want a simple way to measure progress without getting lost in perfection, ask yourself this once a week. Am I becoming harder to knock over? Is my home safer than it was last month? Am I building a body that can catch itself when life surprises me? Because life will surprise you. The goal is to make sure your bones, your muscles, and your plan are ready when it does.